my session. Hope everybody is safe and healthy. This session I have named with a tagline, and I call this as a back in action. So we are back in action. What is the meaning of this? You will see it in next few slides, which I will display it. Okay. Let me just share with you a slide which I came across almost 9 months back, 8 or 9 months back, and that was showed by our CEO, Mr. Ravi Kaushik, in one of the presentation during Leadership Summit at Lonavala. And at that time there was no sign, there was no hint, there was not even a mark for what is going to happen from 17th March onwards. Now look at this slide which it says 5 challenges of IVD companies, and these are the challenges we are already facing it. The first challenge, which you can see it is here, it clearly says that there will be a disease outbreak. If you see the point number 1, it will be a disease outbreak and an epidemic. That will be a big challenge for all the companies. It will be something like Zika virus or very fatal kind of a infection. The second challenge, which was also shown in this slide, was a growing alternate healthcare financing. There are so many people who have started now thinking very seriously about insurance, about their financial stability, protecting them and other things. There was also a point mentioned in the slide which says move towards laboratory automation. Many laboratories, many hospitals, many institutions went for large systems of whether it was RT-PCR or whether it was for a fully automated biochemistry analyzer, robotic arm-based automation, etc. There are 3 challenges which you can see it here. One is the rising quality levels at a lower prices. Then there is the point mentioned local advantages, a strong distribution network. These are the 3 things which everybody has experienced in last few days, and it turns out to be absolutely 100% truth. The last and the most important is sales model and the support. As you can see, this was like a forecast in month of January that our whole model of selling the products will change, and all of us have experienced the way digital marketing has emerged, the way Amazon business, the way Zomato business has come out, the way all these chain labs have emerged. They have opened their branches at airport, at railway, at a very thickly populated areas and gardens and so to do the business, the whole model has changed. What you see from this slide, that everything is coming out to be absolutely true in the current scenario of corona epidemic. At that time when we shared this with you, when Mr. Ravi Kaushik showed the slide, there was no corona, there was no fear, there was no mask, there was no sanitizer, there were no such discussion. It only said the challenges of IVD company which will come through in next few months. It's a very interesting slide where there was already a forecast. Anyway, all of us have experienced this in last 6 months. What this slide said few months back. The next slide, and that slide is of a concern on July 22nd. And the concern was very shocking. I got a lot of calls. I got a call that, sir, customers are asking us to take back the kit which we had launched in month of April. The customer has asked to please come and return my money. Some people also called, sir, it is a big loss. I lost a very big order. Some also mentioned that there's a message floating against Transvasia in the market. There was also a noise created that Transvasia ErbaLisa COVID kit is banned. All kinds of words were used. Some people also raised a question whether license of Transvasia is cancelled to manufacture COVID-19 ErbaLisa kit. And this kind of negative thoughts and messages, they kept continuing it. It was also activity of competitors who were spreading this. Many associations decided not to use our product, not to use our kit. And there was a lot of confusion in the government tenders where people said they are not ready to accept our tender, though it was in our favor. So what all I showed it to you were very disappointing statements. It can disappoint, it can break any salesperson's motivation, and it can demoralize anybody. But there are a lot of encouraging statements. As I repeat, once I mentioned, there are two sides of a coin. One is a crisis and one is an opportunity. So what we shared with you was a crisis. Now let us see the opportunity. There was a wow feeling when all of the transitions received a big news on AMTZ. The facility is ready and Transvasia has launched a COVID-19 kit. The good news was it also gave a huge opportunity, and the Transvasia's strike rate was very high wherever we went with this new opportunity. We also saw that every day 4 to 5 new tenders of COVID-19 and ErbaLisa kit were coming by. There was a phone call from ThyroCare that we need 10,000 tests a day. There was a phone call from Reliance Life Sciences. They need 25,000 tests. All these things. Then suddenly we had a matrix of a tender department. It had some of the numbers which you can see it on the screen. Ministry of Defense, Ministry of Welfare, Director of Health Services, East Delhi, Director General Armed Force Medical Services, Andaman Nicobar Directorate, Director General of Family Welfare, Northern Railway. Everywhere what you see, the number of tests like ranging from 20,000, 10,000, 5,000, looking for a rate contract. All these things gives a very, very positive feeling in a short span of time, and because of that we were back in action. So now what is the action required? The first thing, my request to each and every person is think very positive. Think very positive. Just forget what happened between April to July 22nd. Okay, you have something new, and for that you have to go back to the basics. The first thing is that I want each and every one to understand that you are your own brand. You have your own relationship, you have your own face value, and you have your own trustworthiness in the market. And with the help of that, you have to do a daily prospecting and networking to make this kit available, to make this kit launched in your market. This has to be done by each and every person on a daily basis. When you do your networking, your product will start selling on its own. It will have a magic happening. I've seen if one doctor in Delhi is using, he can tell 13 more doctors to use this kit. It is very experienced. It's a very good kit. We have seen it that customers are the best salespeople and they sell your product, but that is possible only when you have a good networking. You don't have to chase the customer. It comes to you. Why? Because the customer gives you 13 more names. That's a statistics. So it is a time for all of us to visit each and every customer and share that TBM has made its own COVID-19 kit. Therefore, be vocal and be local also. The action required is we still have the lowest time process, and you have to show your videos, inserts, certificates, ICMR, NARI certificates, everything you show to them. Talk to your distributor and explain to them and collect their initial order. The distributor is the first contact point which should place an order. Highlight your new kit, that it is different, it has a different code number, it has a different date, it has a different procedure, and it has a different price also. But the price is very, very competitive. And TBM has decided to go aggressively on pricing in all the tenders. You can use email, but my request to everybody is face-to-face meeting is more important because it is 34 times more successful. People say that it's an old way, old-fashioned, Skype, Zoom, team meeting, everything works, but nothing can beat you one-to-one meeting. And therefore, my strong advice is to make this kit successful, to be in action for our new COVID-19 ErbaLisa kit, you must meet this customer on one-to-one basis. The first place which you have to do it, change your mind. Because if your mind is very positive, automatically you will get a positive results. When you think what you are, you will automatically believe. You have to always believe, and action always beats the intention. Remember this word, action always beats the intention. So you have to act, you have to dress like a soldier because you are back in action, and always dress like you are going to see your worst enemy because you are going back to handle a lot of objections. That's it. You should be well prepared. My question to you is, are we back in action? Yes, sir, we are back in action. Thank you very much and Jai Hind.
Hello everyone, I'm sorry for the inconvenience, I'm back. So this slide in particular depicts time relationship between viral load, symptoms and positivity on different diagnostic tests that we choose to detect COVID-19. Onset of symptoms is usually 5 to 7 days post-infection. At this very early stage or during the asymptomatic periods, as well as at the later stage when the patient is recovering, viral load might be lower than the RT-PCR threshold. Therefore, RT-PCR may miss some of the cases and give false negative results. If we follow these dotted lines, IgG and IgM, we'll realize that IgG and IgM peak at 14 to 21 days. Post 21 days, this IgM starts dipping very steeply, whereas IgG remains consistent relatively. Currently, we have around 0.7 million active cases in India. Around 2 million cases have been successfully cured. Unfortunately, 50,000 have given up against this lethal virus. All labs throughout the country cumulatively have capacity to test around 5 to 6 lakh patients using RT-PCR on everyday basis. But for our huge population, these numbers do not sound too impressive. Therefore, antibody screening becomes all the way very, very important and can play a vital role in winning this COVID battle, not only with respect to health, but at economic front as well. COVID IgG kits are the only effective tools for epidemiological as well as immune surveillance. Presence of IgG could be like a immune passport for the people to join their duties back and contribute to economy revival. IgG detection, specifically if it could be at least semi-quantitative, We don't want a yes or no qualitative essay, but if it is a semi-quantitative essay, it could be used for evaluating vaccine efficacies, as Dr. Fadke told us, as well as it can be used for screening the donors for convalescent plasma therapy. Now, IgG kits can also be used for diagnosis, may not be as an alternate to RT-PCR, but as a complementary test. Capital and infrastructure related investments for labs going for serology is negligible as compared to RT-PCR because molecular assays require cleaner environments. Lab staff needs significant training for molecular assays, whereas serology based test needs minimal training, therefore might be of very useful in remote areas in particular. Last but not the least, among all the tests available to detect COVID-19, IgG kits are the only tools able to differentiate between recent and past infections. These are some of the salient features of our COVID IgG kits. We have validated our kits with both serum as well as plasma, and both of the sample types demonstrated equivalent performance. The performance of a kit comes from the antigen selection, I believe. We have optimized and fine-tuned a particular ratio of spike antigens as well as nucleocapsid antigens. I would also like to highlight that the antigens that I have selected, they were expressed in mammalian cell lines, HEK cells. Now, when we express these antigens in mammalian cell lines, the post-translational modifications are akin to viral multiplication in the human being, whereas some of the companies have picked up antigens which were expressed in E. coli. Now, prokaryotic system is not able to lead to post-translational modifications. As we emphasized, IgG kits which are semi-quantitative can be used for vaccine efficacy determination as well as donor selection for plasmapheresis. We have chosen semi-quantitative estimation based on a calibrator. We can generate an index value. Therefore, we say that measurement matters. All the products that we develop in Transasia Biomedicals Limited or Erba group of companies, we do care that we take customer friendliness into account. Therefore, in this case, what we did is we have ensured that you have to dilute the samples within the plate. Otherwise, it becomes a very tedious job if a customer has to dilute the samples outside and dispense the samples back into the ELISA plate. All the reagents that we provide within the kit are ready to use reagents. Now, this is a differentiator compared to any other kit available in the market because each kit has one or other component which is lyophilized. When you reconstitute this lyophilized component, you get shelf life of around maybe 1 month or maximum 2 months. Whereas with our reagents, you have effective shelf life of 18 months, which is a differentiator according to me. We have tested our kits internally as well as externally at multiple sites in addition to the final trials at ICMR. I am proud to say that we could manage to test our kits with more than 150 positive samples collected at different days post onset of symptoms. In addition, we have tested maybe 100 or 120 cases which were HIV positive, HBV positive, HCV positive, syphilis. In addition, we did interference studies for RF, heterophilic antibodies, all other possible interference like hemoglobin or bilirubin, intralipids, all of them. We have determined that the kit very easily achieves sensitivity and specificity beyond 99%. Our pack size is 96 tests, but I would also like to highlight that you can have strips which you can use for even 2 tests in a time. So basically one strip has 8 wells. With all the controls, you can run 2 tests or maybe 10 tests or 18 tests and so on. In total, you can have 90 samples tested. Our kits are automation friendly. By automation friendly, I mean that we have taken care that incubations have a very, the incubations have been selected so that there is no assay drift. Total incubation time is 90 minutes. Our kits have been finally approved by National AIDS Research Institute, Pune. They evaluated these kits with 90 positive samples and 90 negative samples. When I say 90 positive samples, these were RT-PCR positive with different intervals post onset of symptoms, as well as they were tested on Abbott CMIA. So our kits demonstrated equivalent performance as compared to Abbott CMIA, and our sensitivity as per ICMR was around 96% and specificity was around 97%. Our kits have been enlisted in ICMR list, and another point to be noted is that we submitted 3 batches and all 3 batches demonstrated batch to batch consistency. This is the assay protocol which is in detail described in the manufacturer's instructions. However, there are one or two major tricks I would like to highlight. Number one, when we incubate the kits 37, we provide a black plate which should be kept above the ELISA plate. It avoids the evaporation. Some people miss this and then results may go haywire. Then during the wash cycles, we have to ensure that we give 6 cycles at 2 times. Incubations are like 37 degrees for 45 minutes, 37 degrees for 30 minutes after inserting assay buffer and conjugate. At last, we have to read at 450 and minus the reading from 630 nanometers. ROC analysis is a very useful tool for evaluating the performance of diagnostic tests. Now here, if you could see this graph, the closer the graph is towards the top and left-hand borders, the more accurate it is. Likewise, the closer the graph goes towards the diagonal, the less accurate it is. A perfect graph would go straight from 0 to the top left corner and then straight across the horizontal. Our kits achieved, as I said, 99.12% sensitivity. At 95% confidence interval also, we achieved 99.98% sensitivity, which is huge. Specificity was around 99.75% if we calculate confidence interval 95%. Considering 5% prevalence of COVID-19 in our Indian population, positive predictive value for our kits may reach up to 94.5%, and negative predictive values at 5% prevalence reach up to 99.99%. As I say that Erba group of companies is a solution provider. We provide reagents along with the instruments. And in this case, we know the status where our country is into. So what we have ensured with our semi-automated analyzers, we have made sure that our kits are designed to be used with any other semi-automated ELISA system as well. We have solutions for small scale laboratories which have very low workload, plus the labs which have medium to high throughput screening requirements. For medium scale requirements, we have a beautiful product, Elan 30S, which in my opinion is unique and only one available globally, which is strip based. So what you can do is you can run 30 samples. It's a standalone instrument. You can walk away and this instrument beautifully processes all 30 samples in around 2 hours time. We have ErbaLisa XL, which is a 6-plate analyzer for high throughput screening. With ErbaLisa XL, we can test more than 550 samples in a single go in a single batch. It means it is a go-to solution at the moment, which I see for India because we have huge population. Moving on from IgG, I have another good news to share with our partners. ErbaLisa COVID-19 total antibody has also been approved by ICMR. It detects IgG, IgM, IgAs all together. This kit is again based on a very nicely selected match pair of antigens for SARS-CoV-2. We have again ensured in-plate sample dilution. Incubation time is once again 90 minutes. In this case, we have taken Roche kit as the benchmark and we have achieved more than around 100% sensitivity. Specificity was around 99%. Pack size is once again 96 tests and it is adaptable to automation.